Hi, my name's Kirsten. My student ID number is T00698082. And today I'm going to be going over the skeletal system as well as lymph nodes. And I have my cat Floki here to help me out. So we're going to start with the skull. So starting from caudal going rostral, we have the occipital bone. So the occipital bone makes up the back portion of the skull. Then we have the parietal bone. So the parietal bone makes up the dorsal and ventral sides of the skull. Then we have the temporal bone. So the temporal bone would be down here. It's just lateral or ventral to the parietal bone. We have the external acoustic meatus. So that is a hole in the cranium that leads to the inner and middle ear. So that would be down in here. Then we have the frontal bone. So the frontal bone makes up the forehead. And inside the frontal bone you have cavities, which are the frontal sinuses. Then we have the nasal bones. So the nasal bones make up the bridge of the nose. Inside the nasal bones you have nasal turbinates. So what they are, there's 4 bones that are scroll shaped, and they're covered in very vascular moist tissue, and that allows the air that the animal is breathing in to be heated and humidified, as well as filter out particles like dust and pollen and that sort of thing. Then we have the maxilla. So that is the upper jaw. So that holds the canines, the cheek teeth, and then the molars. And then we have the incisive bone. So the incisive bone is the rostralmost bone, and it holds the incisors teeth on the top. Then we have the mandible. So the mandible is the lower jaw. So it has a body, and then it has something called the ramus, which is the upper projection. So the ramus actually comes up and meets with the temporal bone to form the temporomandibular joint. Alright, so next we have the vertebrae, or the spine. So we'll start with the cervical vertebrae, so that is the beginning of the spine. So you have C1 to C7 for the cervical vertebrae. The first one would be C1, or the atlas. So that is what connects to the skull and articulates with the skull and holds up the head. Then you have the C2 axis. And then from there, it goes C3, 4, 5, 6, and 7. And then we get into the thoracic vertebrae. So the thoracic vertebrae make up the dorsal part of the thorax. So they have tall dorsal spinous processes, and you can feel them by running your finger along the spine. Altogether there's 13 thoracic vertebrae, and they connect with the ribs as well. To feel the transverse processes, you would run your finger along either side of the spine to feel those little bony protrusions. After the 13th thoracic vertebrae, you get into the lumbar vertebrae. So they are much larger because they have to support all the abdominal organs without having help from like a rib cage. There are 7 of them as well, and again, to feel the processes, you would run your finger along the spine to feel the dorsal processes, and on either side of the spine to feel the transverse processes. Alright, so after the lumbar you have the sacral vertebrae. So it's actually 3 vertebrae that are fused together to form this part here. And then from there you have the coccygeal. So the coccygeal are the vertebrae that make up the tail. There can be 23 altogether. Alright, so next we're going to move on to the ribs and the sternum. So the ribs, so like I said before, there are as many ribs as there are thoracic vertebrae. So there are 13 ribs altogether in dogs and cats. So they can be palpated by finding, if you find the last rib, or the floating rib, then you can count your way up to 13. So the ribs themselves are made out of half bone and then half costal cartilage. So where that bone and cartilage meet is called the costochondral junction. The ribs themselves, most of them will connect to the sternum. So the sternum is also called the breastbone. So there's two parts of the sternum that we name. So the upper part, which can be felt up here, is called the manubrium. And then the lower part, which can be felt here, is called the xiphoid. All right, so next we're going to talk about the thoracic limb. So the first bone and the most proximal bone is the scapula. So the scapula, the orientation you can feel kind of comes around this way and then comes down this way. If you feel along the middle of the scapula, you can actually feel the spine of the scapula. Going down from there, we're going to get to the humerus. So you can tell you're at the humerus by feeling this protrusion here, and that is called the greater tubercle. So moving distally down, you would get to the radius and the ulna. So the ulna actually has a bony projection that makes the elbow joint, and that is called the olecranon process. So if you follow that distally down, you know you're feeling the ulna. And then the radius is cranial to that. The radius is actually the main weight-bearing bone of the forelimb. Going down, we have the carpal bones. So the carpal bones, there's actually two sets of them. There's two rows of bones. You have the proximal and the distal. The proximal actually have names, so the radial and the ulnar carpal bones. And then from there, you have the metacarpals. So the metacarpals, in cats and dogs, there's typically 5, and they are named going medial to lateral. So you would start with M1, and then you would have M2, M3, M4, and M5. From there, you get to the digits. The digits are made up of usually 2 to 3 smaller bones called phalanges, and they are numbered going proximal to distal. So you would have P1, P2, and then P3 down here at the bottom. Okay. All right, so next we're going to talk about the pelvis. So the pelvis is actually made up of 3 bones. So you have the ilium, the ischium, and the pubis. So the ilium actually in cats and dogs has wings. So there are dorsal cranial projections that you can feel right here and right here. So next we have the ischium. So the ischium is the caudal-most part of the pelvis. So it has 2 projections that come out back that are called the ischial tuberosity. So they can be felt on either side of the anus here and here. And then the last part is the pubis. So the pubis is the smallest bone. The pubis actually meets up with the ischium and the ilium to form the acetabellum. So what the acetabellum is, it's that socket in the ball and socket joint that joins with the femur. The pubis as well has 2 holes, which are called the obtuator foramen, and that's where some blood vessels and nerves actually go through. So going back to the acetabellum, so again, we said that the head of the femur actually sits tightly inside of that joint. So we talked about the acetabellum, so that is where the head of the femur sits. So across from the head of the femur, you have another part or projection called the greater trochanter. So you can palpate that here on the side. And then moving distally, you would move down the femur, which would be down this way. So feeling along the femur, you would get to the patella. So the patella is the kneecap. So feeling the patella, it's just a little sesamoid bone there. All right, so moving down from the patella, we would get to another projection of the tibia, which is called the tibial tuberosity. So feeling distally from that, you would feel a ridge, and that is called the tibial crest. All right, so after the tibial crest, so you'd follow the tibia distally down to the tarsus. In behind, or caudally, you have the fibula. So the fibula is just a very thin bone. It doesn't have any weight bearing. It doesn't do any weight bearing. It's mainly just a spot for muscles to connect to. The tibia is actually the main weight bearing bone. So from there we get to the tarsus. So there's a bony projection here, which would be equivalent to our heel bone, and that is called the calcaneus. From there we get to the tarsal bones. So again, 2 rows of tarsal bones, proximal and distal. You have the tibular and the fibular proximal bones. And then from there you have the metatarsals. So the metatarsals are actually different from the front. There's usually only 4. And they are, again, named or numbered from medial to lateral. So you wouldn't have a T1, it would go T2, T3, T4, and T5, or M2, M3, M4, and 5. And then the digits, there are 4 digits in the back. Excuse me. There are 4 digits in the back, and again, those ones are numbered, the phalanges are numbered from distal to or proximal to distal. So you'd have P1, P2, and P3. So in the back, there are 4 digits, in the front, there are 5 digits. So lastly, we're going to go over the lymph nodes. So the first one that we have is the parotid lymph node, so it can be felt on either side. It would be felt kind of up here. And then you have the mandibular lymph node, which would be felt similar to right around here. Then you have the prescapular. So the prescapular can be felt on the front of the chest here. With cats, they're very small, so it's a little harder to palpate them. Then you have the axillary. So the axillary would be like in the armpit. So you would feel it up in here. You have the inguinal, which would be felt in the crease of the leg, down in here. And then lastly, you have the popliteal, which is actually on the opposite side of the knee. So it would be felt right in here. So that is everything. So thank you for watching, and thank you, Floki. You're free to go.